Good evening, everyone. This is Meldita, and I'm back. And our topic is about the heart's electrical conduction, its anatomy and physiology. On my left side is the heart. We have the SA node here, the interatrial pathways. We have the AV node, the branches, and the Purkinje. The SA node is the pacemaker here, and we're going to talk about the heart, the normal heart here. So the SA node will generate electrical impulses. The electrical impulses will travel via these pathways inside the right and the left atria. These are the tracts. The anterior internodal tract. There is the middle internodal tract, which is called the Wenckebach. And we have this posterior internodal tract called the Thorel. And there is the interatrial nodal tract, which is called the Bachmann's bundle. They carry the electrical impulses. This will stimulate the left atrium, and the other three will stimulate the right atrium. They cause the contraction of the atria, and the other impulses travel to the AV node. And there's a delay in here of about 100 milliseconds. The AV node will filter the impulses. The impulses will go to the bundle of His, to the right bundle branch, to the left bundle branch. But there are two divisions in the left bundle branch, which is the left anterior fascicular branch, and there is the left posterior fascicular branch. The electrical impulses travel via these Purkinje fibers, and that will stimulate now the ventricles. So there's contraction. So going over to the order of travel of the electrical impulses. So the SA node will generate the electrical impulses. Electrical impulses travel to the atria via these internodal tracts, interatrial tracts, to the AV node. There's a delay there. Proceeding to the bundle of His, to the right and left bundle branches, to the Purkinje fibers, followed by ventricular contraction. The same with the atria, followed by atrial contraction. So this myocardial cell has properties. We all know that the myocardial cell has electrical or conductive cell and contractile cell. The electrical or conductive cells, they have these properties. Automaticity, they can generate an impulse. An example of that are the pacemakers. The SA node is a pacemaker, which is the highest. The AV node and the Purkinje, but they're slower. And excitability, yes, the conductive cells have the capability to be excited or respond to electrical stimulus. Refractoriness, if there's already the first stimulation, they cannot be responding to the second stimulus. So that is refractoriness. Conductivity, the conductive electrical cell, they are able to transmit electrical impulses from cell to cell because of their structure with the help of the intercalated disc at the end of the cells. And the contractile cell are responsible for the contraction. So if the heart will beat for as long as it wants, do you think that is allowed? No. The nervous system will be able to check that out. And the autonomic nervous system has actually two systems in here to deal with the heart rate or, conduction or contraction. So the sympathetic nervous system actually speeds up everything, while the parasympathetic slows down. So they check each other's out. So if there's sympathetic stimulation of the heart, that is the B1 receptor accepting that, and there's the arteries via the alpha-1. Example of sympathetic stimulations: exercise, anxiety, drugs, sickness, infection. So if we will stimulate sympathetically the heart, we will be increasing the SA node pacing. We will increase the conduction rate, and we will increase the force of contraction. Those are the effects on the heart. How about the arteries? There will be vasoconstriction. Parasympathetic nervous system, once they are enhanced or stimulated, they do the reverse or the opposite of the sympathetic stimulation. With regards to the heart's response, the rate of pacing slows down, the rate of conduction slows down, and the force of contraction will be weaker or slows down. And the arteries will dilate. Okay? Going upward here, there's another drawing of a heart in here. I did this. So we all know from the SA node to the atria, that jives with the P wave. From the SA node to the atria, and the AV node, that jives with the PR interval. And the His Purkinje, that's the QRS, that's ventricular. So down below here, that's the P wave. Okay, that jives with the SA node to the atria. The P wave is actually the atrial depolarization. And the PR interval is actually the contraction. And that's when blood fills the left ventricle. The actual emphasis of this is more on the left side because the LV is the main pump of the body. Okay, and then the QRS, that's actually the depolarization of the ventricle. And if you see the ST segment in here, that is the systole. That's when the aortic valve opens and delivers the blood to all parts of the body except coronary circulation and the T wave. So what is the problem with this overdrive suppression here? Overdrive suppression is one property of a dominating pacemaker. So when you are a pacemaker with the highest rate, you have the property of overdrive suppression. We suppress, the pacemaker suppresses all the slower pacemakers. Example, the SA node has the highest rate of 60 to 100, while the AV node is 40 to 60, and the Purkinje is actually 14 below. So they're slower. So SA node dominates over these slower pacemakers. So what happens sometimes if this heart is sleeping and suddenly it goes slower below 60? If this is a normal heart, yes, the AV node can take over. So the overdrive suppression is gone. The AV node able to escape, and the rhythm is now called the junctional escape rhythm. If this keeps happening all the time, then it's not normal anymore. So this patient needs to be checked by the cardiologist. Okay, so that's simply about this conduction. And the reason I put this as my presentation, because going to the ECG, we need this. Okay, and I hope you like my presentation about this electrical conduction of the heart. It's anatomy and physiology. And if you like this, you can press the like and subscribe button. And there's no fee for subscribing. Thank you so much. Bye.